When a young girl needed complex heart surgery, her parents were prepared for a massive operation and weeks of recovery. Instead, she was sitting up in bed and drawing with crayons just days later. This recovery relied on a specialized AI-assisted robotic surgery system. The machine did not perform the operation alone. It was never designed to. Instead, the artificial intelligence acted as a physical filter. It monitored the surgeon's hand movements and removed their natural microtremors. With this stabilized control, the doctor could make 3 precise millimeter-wide cuts. Surgeons are limited by the physical boundaries of the human body. In the operating room, artificial intelligence serves as a precision co-pilot, providing the stability needed for the most delicate procedures. That co-pilot role begins before a patient even reaches the hospital, starting with the data we generate every day. A common fitness band continuously tracks metrics like your heart rate and sleep quality. By establishing your normal baseline, the software can detect when your heart rhythm deviates and alert you to seek medical help before a crisis occurs. Once you arrive at the hospital, the volume of information expands. Look at this spinal MRI. Doctors must parse through a vast amount of visual complexity to find a single anomaly. This diagram illustrates a branch of AI called computer vision. By acting as the digital eyes of a machine, it can process and analyze dense medical images in a fraction of a second. The software highlights pixel-level areas of concern, identifying early-stage infections or microscopic tumors that a human eye might miss during a long shift. Computer vision acts as a hyper-vigilant scout, marking the exact locations where doctors should apply their human expertise. This technology scales up when doctors face an even bigger challenge, diagnosing a rare illness they have never seen before. Traditionally, a physician would spend weeks scouring global medical journals, trying to find a patient with a matching history. Data science algorithms can scan millions of global medical records in seconds, matching a patient's symptom profile with identical cases found worldwide. By turning weeks of research into seconds, the technology gives doctors back their most valuable resource, the time to actually care for their patient. If an algorithm is this fast, why shouldn't we let it make the final medical decisions? The danger lies in AI bias. An algorithm has no inherent ethics. It only learns from historical data, which can carry flawed human assumptions. One recent healthcare risk algorithm was tasked with predicting how sick a patient might become in the future. The algorithm developed a specific logic. It judged a patient's health risk based on how much money they had spent on medical treatments in the past. This is measurement bias. The AI measured low spending and assumed it meant a healthy patient. The human context reveals a different story. Poorer patients often spend less because they cannot afford treatment, even when they are seriously ill. Because the system lacked socioeconomic awareness, it graded these patients as low risk, potentially delaying life-saving care. This is why high-stakes fields require the human-in-the-loop principle. AI remains a support tool, while human authority makes the final call. Healthcare depends on human empathy and ethical oversight, now augmented by the precision of artificial intelligence.